one.
Okay, I have Eddie Connors here, 69,000-mile retired postal worker.
Yes.
And I'll tell you, I think it's an occupational hazard. I have a lot of mail carriers over the years that have worn out their knees.
Mm-hmm.
And, it's a price you pay for serving the public for
Right.
that long. But anyway, your knees wore out, and we did both knee replacements. We called them outpatient rapid recovery total knee resurfacing. We did them a year apart.
Yes.
So when we started the one a year ago, were you skeptical at all that we were going to do this as an outpatient and send you home the same morning?
I was not, Dr. Meade, because I was referred to by Paul Scheiker that you had seen prior to me. And he told me how wonderful you were as him as a patient, what kind of a recovery, and everything he said to me was this. I knew what was going to happen from minute one. Medications, before the surgery, after the surgery, there were no guessing games. Everything was up front, and it was absolutely as you had said, just the same experience.
So we call that patient engagement. Patient education is critical. Historically, it was a black hole. We operated on people, you woke up, you stayed in the hospital for 3 days. Now we know that you're not sick, you're a healthy person. You don't have to be in a hospital.
Right. Exactly.
And you live an hour and a half away from where we did the surgery.
Correct. Mm-hmm.
So what, for either knee, do you remember what time you came in and what time you went home?
I believe I was in at 7 o'clock in the morning for both of them.
Yeah.
Roughly, and at 9 o'clock or 9:30 in that time period, within 2 hours or so, I was in surgery, and I was literally on the turnpike by 1:30, both knees,
Yeah.
from one year to the next.
So a lot of people, historically, we used to do both knees at the same time. We don't do that anymore because we do them as an outpatient. And people say, oh my heavens, if I do one, I'll never come back and do the other one. After you did one, did you have any hesitancy coming back and doing the other one?
It's funny, Dr. Meade, because when I came to see you in September about this, I literally, in 1 year, this thing went bad. Whether it was kind of compensating for this bad knee of 18 years, this went bad in like 1 year. And you had said to me, well, we can give you a shot if you'd like. And I said, no, I want to get this taken care of now. I really felt, I had such a good experience with this knee.
Yes.
I had no doubt of what was going to happen with this one. I didn't.
So, and we've changed our whole outpatient protocol where we let you do your own exercises for a week or two, and then we individualize it and we send you to therapy for a handful of visits, which you did very well with. And the other change is our multimodal pain management. We use different non-narcotic medications to limit and sometimes eliminate the need for narcotics. Do you recall if you needed much narcotics with these?
I used 0 narcotics for these knees. I used extra strength Tylenol for the first week or so to catch up the little bit of pain. And when I say pain, Dr. Meade, I'm not talking about pain where I couldn't stand it. I took my Tylenol, my 350 or 500 milligrams, whatever that was, as prescribed, and that's all I took. I mean, I took my medications to get me through the process, but no high potency medications at all. I did not take one thing like that.
And I think the supplements help too. We have fish oil and L-arginine, and all these things enhance wound healing, decrease inflammation, and you were a big runner for years prior to this.
20 years.
A self-proclaimed Forrest Gump type of runner.
Forrest Gump, exactly. I was. I thought I was always 220 pounds, and I had friends of mine that said, you look like an idiot out there because you're 220 pounds and you're running. I said, well, that's okay, but that's the way I felt. I wanted to run, and I felt great running.
Yeah,
I did.
It's great.
It's just
the endorphin effect, the high runners get.
I loved it, but 20 years later, I started getting little tingles in my knee, and went to the doctor, and they said, man.
And how about the gym now? What are you doing in the gym?
In the gym, I go down to the gym 4 days a week. And I get on the treadmill. Actually, treadmill was yesterday. I started the treadmill. Before the surgery, I did a lot of bike, getting the knee ready for surgery. I felt like keep the mess, because you had prescribed, keep the thing in shape as best you can. And what I did was, I felt, right now I do 20 to 30 minutes on the treadmill and 15 minutes on the bicycle now. And I'm only 6 weeks into this knee.
Yes.
That was the same experience with this. It was a little longer because I let this knee go a long time. This knee went 1 year, and I gotta tell you that this was just amazing how this healed and how I was able to get back. You know, Dr. Meade, the protocols that you gave me the day after surgery, those 4 exercises
Yes.
to do for up to 8 hours. When I came down to see your physician's assistant 10 days after the surgery for a checkup, and he had looked at it, and he said, this is amazing. Your range, as I moved my foot back, was over 100 degrees, and it was only 10 days. And I said, well, I believe in my heart that doing those 4 protocols, I couldn't do nothing the first day after. Literally, it hurt.
Right.
Don't, you know, I'm not gonna lie. But every day I did it, it got better and better. And by the time I came down here 10 days later, he said my leg was at 100 degrees or 100 and some degrees, and that was astonishing for only 10 days.
It was. Well, other patients will appreciate all this information. Do you have any final recommendations or advice for anybody that has a hesitancy about doing this as an outpatient on our opioid sparing protocol?
If they have hesitation at all, Dr. Meade, your name is in my speed dial. I'm going to give it out to everybody because it was a wonderful, wonderful experience with both of my knees. I and my family thank you so much.
You got it. And I want to give our team approach, because it's not only what we do, but the Coordinated Health Lehigh Valley approach, our outpatient protocols and pathways we've developed. So thanks so much. And
It was a pleasure, and I want to tell your staff in Lehigh Valley, anytime I ever called, they got back to me. If I couldn't get them directly, they got back to me. They were all so courteous. They're wonderful.
Great. Thanks so much, Ed.
Thank you, Dr. Meade. Thank you very much.
You got it. So this